Hello, everybody. This is Mark Lynn with Healthcare Business Specialist in Chattanooga, Tennessee, and I am with Elizabeth Burrows, a lawyer from Indiana, and she is with Burrows Consulting. And this is the rural USDA grant update that Elizabeth is going to give us today on how rural health clinics can obtain some of this funding that the USDA is going to provide for rural communities as we fight COVID and provide healthcare in rural areas. Here is my contact information if you do need to get a hold of me. And Danny Gilbert is with us as well. If you do have questions, you can type those into the question panel, and Danny will watch for those. And when the session is over, we'll read those to Elizabeth, and she can respond to those. If you've not joined our Facebook group, we have about 2,700 members and would love for you to join. This is going to be the fastest way for you to get information about webinars and about rural health clinics. And we're thankful to that community and to all the different consultants and people that contribute to it. It is a great resource for our rural health clinics to ask questions and get answers from your peers. Our website is called ruralhealthclinic.com. That's where you're going to find the presentation for this session here. We've already put the presentations on there. So Elizabeth's presentation is there if you need to get a hold of it. I've also put it in your handouts. Hopefully the handouts will work. GoToWebinar is sort of, it's usually 50%. One of them will download very easily and the other one will not. So hopefully we'll get 100% of them being able to download. If you can't find your handouts there, you can find them on ruralhealthclinic.com at the /COVID-19. I already posted them there as well. And we are going to have another webinar coming up on September the 15th on provider relief fund reporting. So I know you guys, September 30th is the due date for that. So we're going to go in and give everybody an update on what we found out from the provider relief fund reporting that we've done up to that point. So keep that on your calendar. Again, if you want to ask questions, just type those into the sidebar, and we will address those at the end of the session. The information is current as of today, and the session is being recorded. And I think Elizabeth and my crystal ball is probably not as good as it was a few years ago. So we will give you the best information that we can at the time. And here is Elizabeth's picture and her organization there. She's just been doing a fantastic job on FQHCs for many, many years. She's been working with rural health clinics with rural grants for many, many years. She's got the expertise that we do not have. And so this is why we've had these series of webinars for our rural health community, because I think they've been invaluable. I know we had so many of you guys that did get the Rural Confidence Grant. That was $49,200 and something that everybody got. And none of us would have been able to get that without Elizabeth helping us to get that done. So without further ado and bragging on Elizabeth, let me make her the presenter, and hopefully I'll send this one to the right place. Elizabeth, you should be, in theory, the presenter at this point. If you're not, let me know. Let's see here. And can we try it again?
Well, I'm trying to share with you.
Let's see here. I'm gonna try this one here. See if this one works. Did that work? Oh.
Can you see my screen?
I cannot. I'm seeing my screen. Wait a minute. Let's see here. Yeah, I'm still seeing my screen. Wait a minute. Let me go back.
Yeah.
Yeah, I'm not seeing your screen all of a sudden. Do you want me to just run through your slides for you?
Sure.
Okay.
Sorry about that, everybody. I have it pulled up and it's looking good, but
I don't know why it doesn't like you sometimes. So I know we had a problem with that the other day.
It did not like me last time. We should have practiced a little more, I suppose.
Yeah, I thought that we would have it
perfected by now.
Yeah, no. Okay, can y'all see my can you see the presentation now? Let's see. There we go. Slideshow. Mine is doing weird stuff too. Can everybody see? Can you see what's on my screen?
I can just see your face. I can't see your screen.
Oh, all right, let's go back. Okay, maybe, let me go back. I don't know why this thing's acting weird. Okay. Make another presenter. Okay, Mark Lynn, organizer me, show my screen.
All
Okay,
right.
can you see it now?
Yep, now we can see your
See
first
you?
presentation, so we'll pull up the other one. So just to get started, if you haven't seen all the news, USDA has $500 million to give to rural health. If you have worked with USDA, been familiar, been a county commissioner, or done anything related to USDA, you know they have a lot of rules. Those rules are still in effect because they do have to follow their legislation. However, this is a lot of money for USDA and they are very excited to get it out the door. In fact, I've talked to a couple of my contacts there and they are actually concerned that they won't be able to spend this money. So we definitely, I know, can help them spend it. So first things first, as I say with grants, always know your why. Know why you want to do this, know why you care, know why you want this project to happen. And I'm going to pick on one of you, but one of you was telling me the story about what you'd started doing and building the day after the pandemic hit last March. Almost brought tears to my eyes about how you were building and adding space to meet the needs of your community because no one else was doing that. That is the why. That's why we do all these things we do, but make sure you know that. Next, are you a nonprofit? I know many of our RHCs are for-profit, so the question becomes, are you a nonprofit? If yes, you're fine, you can apply. If not, you go down the other path. Do you have a nonprofit or a nonprofit partner that could apply? I know in talking to some of you, you guys have formed nonprofits, say 3-4 years ago, for maybe this very reason to try to get grants. Or maybe you have a great nonprofit partner. Maybe you're on a board of a nonprofit in your community. In Indiana, we have all community foundations in every county, so those can help be passed through. So find a nonprofit partner that can and will apply for you. Were you already planning a construction or an expansion project? You know, think about that. Was this something I wanted to do? If you were happy where you were and it was a great facility and everyone was happy, you don't want to just see dollar signs, $500 million and say, I'm going to do it and I'm now going to add all this space and do all these great things. Don't just see money and try to go for it. Again, grants only make sense when they supplement or align what you're trying to do, your overall plan. I know my mentor at Union Hospital, she always said, don't just go after money. You need to make sure it's part of what you want to do. So think about what you were already going to do. If you were already going to add a food bank, it probably makes sense to go after this money. If you were already going to add behavioral health, it definitely makes sense to go after this money. If you were already going to add more providers or your roof is already falling in and you definitely needed to make a change in the next few years, you definitely should do that. So how to begin? Did you grow or expand your physical structure to meet needs? Sorry, if it says COVID-10, clearly we know it's COVID-19. I apologize for that. But did you grow? Did you expand? Did you add a carport? Did you add a tent? Did you add rooms? Did you add special air vents and HVAC systems for your rooms? If so, that's something you could get reimbursed for. Were you planning to do a new construction or a build? Do you need a mobile unit or a vehicle? And honestly, I'm going to say that again. Do you need a mobile unit or a vehicle? Those are probably the easiest and quickest projects that you could implement. Many rural communities have issues with transportation. It continues to be top of critical access hospital needs assessments over and over and over again. It continues to be top in HRSA reports over and over and over again. So this is your chance to get a mobile unit or a vehicle. I'm going to explain a little later why it might be easier to do that than expand space, but again, all of these projects are allowable. What are the needs of my community and how am I going to meet them? So look, if your community already has 5 behavioral health providers, probably adding another behavioral health provider is not what you need. If your community already has incredible public transportation and we already have a USDA van that goes and picks everybody up, great, you probably don't need a vehicle. If your community is lacking in any certain service or your community, you already know that if I called your clinic today, it would be 2 weeks out to get an appointment. You know, that's a problem. So yes, then those are the needs of your community and you should make expansions accordingly. And then what are the needs of your community as a result of the pandemic? And do you want to grow and expand to meet those needs? So I've talked to some of you who say, oh, well, we know after the pandemic, we definitely need more providers. I'm trying to get a doctor. I'm trying to get a nurse practitioner. I'm going to grow. I need to add some rooms. Great. That makes sense. If you say, hey, we're really happy where we are and we don't want to make changes, you might want to just jump off this webinar and say, okay, this isn't for me. I'm going to pass on this one. But if you are willing to grow and expand, this could be the perfect opportunity for you. Okay, so some things that you really have to think about. First of all, every state has a USDA Rural Development Office. Every state has a presidential appointee director of that office. Under them then are a lot of what we might call bureaucrats or federal government lifetime employees. Many of the USDA rural development people have reduced staff. So I know I worked at USDA all through college, and our staff at that size in Indiana was about 90 to 100. They told me they're now down to less than 40. So just keep in mind, they're still doing all the same programs and then have this new program, and they are on limited staff. You have to think through your match. This is a really weird grant because most other grants, you are not allowed to use other federal grants or provider relief funds or federal dollars. You aren't allowed to use other grants, period, for grant match. This one, you can. You can count. USDA is, I believe, one of the only federal agencies that lets you count other federal dollars for your match. So hopefully you all got the $49,200 blah, blah, blah dollars, at least per clinic. Maybe you got provider relief funds. Those dollars can count for your match for USDA. You, of course, can use patient income for your match, other grants for your match, and you can even use in-kind items for your match. So I know a couple people have asked, we got PPE donated to us. Yes, I believe that is allowable. It would be at your state USDA Rural Development Office's discretion. But yes, all of that can and should count. There are no per se limitations. But again, USDA leaves a lot at the discretion of each state. And not each state's USDA Rural Development Offices are created equal. So think through your match, look at the dollars you've received, and all of those do count. The CARES Act can also count. Again, you have to look at what you spend it on and make sure it's an allowable match, but as long as that's being spent on staffing and stuff, that should be an allowable match. Keep in mind with USDA, there are a lot of rules, but the people do care. I have never met a USDA rural development employee that says, I hate rural and I don't want to help you. They all seriously do want to help you. So reach out to your local state office, make friends with them, and also start getting together all your paperwork. Because even though, yes, you want to have contacts, they still are going to require you to turn everything into them in a big file. You do have to use their resources and a couple of their rules that I know some of you have asked me about, and then a few of you said, hey, I just can't do it. You do have to follow Davis-Bacon. I am not a Davis-Bacon expert, so you definitely can look at legal counsel or compliance experts in this. But I do know, as a person who ran health centers that received USDA funding, we had to follow Davis-Bacon, and it made sure that we had to pay appropriate salaries to all of our construction workers. So it is a higher pay. You have to pay people a higher amount to meet the requirements of Davis-Bacon. In other words, you can't say, well, I've got people who will work for $50 a day. That's not good. Even though you might have people that'll work for $50 a day, take advantage of that maybe. That's up to you and your own discretion. But you do have to pay people according to Davis-Bacon. Those are according to federal pay standards. And there are certain documentation requirements along with those that most CPAs are aware of, and even engineering firms know. When you tell them you have to follow Davis-Bacon, your construction firms should be familiar with that. You also have to do environmental reviews. So in my experience, I had to battle some things because my clinic was located in a floodplain. Did I know my clinic was located in a floodplain? No, I had no idea of that until I went through an environmental review. So you do have to do environmental reviews. There are some links on the USDA webpage that I'm going to share at the very last slide, and you can go to that. I'm sure you've already got notice of the grant. You can go on their webpage and play around. If you want all the exact construction information in one email, email me and I will send it to you. And I've been told some of the links don't always work, and it is long and arduous. this is what I'm going to tell you. Don't read it. Your architect, engineering, or construction company that wants to do the work will know those things. Up to $500 million for access to testing, rural healthcare services, food assistance. There are 2 tracks. I'm going to focus mainly on track 1 because that is really where most of you will be getting your funding. There is track 2, but there's only 12 awards nationally. It's going to be highly competitive and you have to have a lot of partners. So track 1 is $25,000 to $1 million. Track 2 is $5 to $10 million. And we'll talk some more differences. So we'll go on. Keep in mind with track 1, you can get up to $1 million and there will be additional opportunities to apply over the next few months. So the first deadline is October 12th to your USDA office, not grants.gov. You do have to have your SAM and be up to date and make sure all of that is still registered legit and has the right people. So you always want to keep your SAM up to date and have your appropriate registrations, which most of you should have. But you do actually turn this into the USDA office. After that, there will be rolling every 2-month cycles until they spend all the money. Here's what you can do. Capacity for vaccine storage. Most of you, I think, already have this taken care of. PPE. Reimbursement for lost revenue. It says more on next slide. You can go on I stole this. This is directly from USDA stuff. You can go on the USDA website and look at lost revenue. I'm not going to speak to that because Mark probably knows more with provider relief funds and lost revenue. And mainly what they're talking about lost revenue is it can be used for your match. Increased telehealth capabilities. I'm going to say that again. Increased telehealth. That's a good project because that's something USDA has been funding for the last 15 years. So I think it's something they're committed to and they should know about. Construct or renovate facilities, which is what many of you want. Staffing needs. This is foreign to USDA. In fact, I've talked to my friends at USDA. They're like, we've never been able to pay for staffing, count staffing as a match. So they are all new to that. So if they tell you we don't know how to track that, don't get mad. This is just new to them. They've never been able to use that. Support facility equipment and increased operating expenses with food banks. And you can pay professionals, so your engineering fees, if you have a consultant fees, any of that can get wrapped in. Engineering, architectural, accounting, consultants, all that can get part of the grant. And you can go back to last March. Track 2, again, you have to have 3 or more entities. They really have to be rural. There's going to be 12 pilot projects, and they're going to expect you to really set the bar high. These are projects that we found a problem. We've got all these people working together for it, and now you're going to model that for the nation. If you have a consortium, this could be great. I've talked to some of you who are like, well, we've got this board, and the chamber, and the United Way, and the FQHC, and the RHC, and we're already doing this, and we're addressing, you know, a big problem in our community. Great, that might be perfect for this. But again, you have to make sure all your partners are in line, and I really think track 1 will be the better fit for most RHCs.
Do you want to film that?
Yeah, we went through that. We're fine.
Okay.
We don't.
I thought you did. Okay.
Just for you guys, skip it. Okay. I've already had some of you calling and upset with me about how USDA defines rural. I just stole this from the USDA website. I'm not the one that makes the rule. I know people are kind of upset. This is how they define rural. They cannot change this. Now we're going to talk a little bit about this. These are the rules, and so I copied them on the presentation that goes public. Now we're going to talk in some ways to be creative here, okay? You have to be located in a place of 20,000 or fewer. Now, if it's owned by a mothership out of the big city and it's in a rural area, that's fine. The big entity can be housed in an urban area with the facility in a rural area. The facility or project must also primarily serve rural residents in areas of this small. That's where your mobile units, your vans make it very flexible. You can look at your whole county. You still may serve other places, but you could also serve this small town, this small census tract, this small area. So that's why the mobile clinics, the mobile units, the transportation vans might make sense. Ambulances, but I know my audience stays primarily RHC, so I think most of you probably don't have ambulances, but that could be something you would want to do. because then you have the ability to move and say, this is where we're serving, this is where we're helping. Instead of when you build a facility, it is in that town, this is the size, you don't have as much flexibility. You also, your service area can be as big as a county, a town, or as small as a census tract. You also can do things with schools, and they can base it off the population of the school. So that can be a help. That's not on any of the USDA websites. That's just something I've learned in my experience. So if you want a school clinic, if you want to do certain school outreach, look at the poverty levels and the size of your schools, and that can help. Something else a couple of you have called me or texted me that you're angry about. I don't know why they're using the 2010 data census when we had a 2020 census. I'm just telling, I know some of your rural communities have, I've had somebody saying our rural communities went down about a third of population since 2010 because we lost this employer and this employer. Those are things that we can explain in our narrative, but this is the data that they're using. This link, if it does not work, I stole it directly off USDA. And you have to go and look at this area. Again, if the population has changed, that's something you can explain to USDA, you can put in your narrative, but they are required to use these numbers. So if your population was, 21,000 in 2020, and now it's 16,000, sorry for your luck. Like that, these are the numbers they're going to be tied to. So again, start thinking of other projects. You know, do I want tents? Do I want clinics that are movable? Can I go somewhere else? Does another town make sense? Median household income, this is what they're doing it. So your grant, you can get, for your total project cost, you can get 15%, 35, 55, or 75% paid for. And it depends on the median household income. One thing that my state USDA did allow me to do is we were tracking incomes because we had a sliding fee scale at my clinics. So even though my city or town where I was located didn't qualify, we had the survey, we knew what our patients were, and that showed median household income. So if you can build partnerships with USDA and you have some of that data for the people you serve, for the school you're serving, for the area you're serving, that can be helpful. This is also, let's say that you've thought, I want to go, there's 3 different towns I want to go to. Run the numbers and look at what town you could get. If you can get 55% of your project funded in one town, only 35% in another, I would then choose to go to town A instead of town B because I can get more grant money. Yeah, you might have been planning to go to B first instead of A, but because of this, this might change your plan slightly. If so, this is a time to follow the money. You're already going to go to those towns. It makes sense. Make your plans and follow accordingly. Okay. So some things to consider. First, are you willing to follow all of their rules? And I know some of you have said, you know, this just isn't worth it to me. That's a choice we all make. You know, I had a septic system in one of my RHCs that was funded by USDA. It was worth it to me. I know hospitals that are funded by USDA. It's worth it to them. You know, I was at one in Illinois that in the middle of a renovation, a hospital and clinic building that is getting USDA funds. So it was worth it for them. But you have to determine what makes the most sense for you. Can the project relate to USDA to COVID in some way? I even saw a study this week, dental can be related to COVID. So, you know, think of whatever it is you want to do and can it be related? My guess is it can, but again, it does need to relate somehow. What nonprofit can you partner with if you aren't a nonprofit? Look at that, and I guarantee somebody is going to be willing to partner with you. Look at how this will help your community. Again, it goes back to knowing your why. Why are you doing this, and is this really going to help? If you really think it's not going to help and people aren't going to want telehealth and nobody's going to want remote patient monitoring equipment, then it's not worth it. If you're not passionate about that, don't do it. But if you really think that it can help and you believe in your cause, it will definitely be worth it. How can I spend the big money in the best way to help during these unprecedented times? This is a great opportunity that rural clinics have access to $500 million in ways you've never had access before. So please, please, please consider taking advantage of this exciting program. This is your chance. And feel free to reach out to me. And I also have the USDA link. They are posting frequently asked questions regularly. So you can go in and add your email. So if you think you might apply, I would go in, follow the rd.usda.gov link, add your email, sign up, so that way you know when they post new information about the grant. They are still figuring it out. I mean, we're trying to get on the plane as they're trying to build the plane. So keep in mind, I know some of you have been aggravated and you call your office and they have to get back to you with answers, and you know, they're waiting on the FAQs to come out themselves. So this is a new project for them. Give them time and some grace with that. And please watch the website because more information is coming. And get started today. It sounds like, oh, it's August and it's not due till October 12th. It is, we're about what, 6-7 weeks out. Get moving on this as soon as you can, because again, in some ways it is first come, first serve on this. Also, if you have proposed projects to them in the past, there are some slightly easier rules now. So if they told you they were out of money last year, this is new money for them. So again, if you weren't rural, you can't get around those rules. Those are the same rules. But if it was, hey, we're out of money, we can't fund you now, go back to them because now they have a lot of new money. So I think that's all. You can always reach out to me. I'm glad to help. And if we have any questions, I'd be glad to take those.
Okay, thank you, Elizabeth. We appreciate that. It is certainly an exciting opportunity to get our hands on just a portion of this $500 million. Danny, do we have some questions over on the sidebar?
Yes, sir.
Okay, what do we got?
They are coming in. One says, I read that if an organization is for profit, it may be eligible if it can show that it ties to rural healthcare. Are you aware of this as an option, and what are the requirements would be to make a for-profit eligible?
Well, one thing I'm going to tell you is you always can start a nonprofit. So use the easy form and start a nonprofit. I'm sure Mark or I could assist. So that's one option. What I am seeing on the USDA website is it has to be nonprofit. I mean, they seem really set on that. I'm not saying you can't do, you might be able to partner with your town or your community and let them be the grantee. But I even checked just the FAQs this morning. It was really clear that you can't be a for-profit. I agree. When I originally read it, I thought for-profits could apply. USDA does have business programs where for-profits could apply. But everybody I have talked to, the webinars I've seen, they are saying nonprofit. If you can call your USDA office and they say there's a way around it, I would love to know, because I would love to learn that. And I don't understand. Some of you said, why are they against the for-profit RHCs? I'm not even for sure they were completely aware that so many RHCs were for-profit when they put this out. But what I was explained is the original law does require it to be a community, a governmental entity, a tribe, or a nonprofit. So they're following a law that was passed for USDA years ago.
Okay. And I'm going to try to combine 3 questions into one. So bear with me as I read it, because it all has to do with the nonprofit aspect. If we have 0 nonprofit partners, how quickly can a nonprofit be approved if we were to apply?
Well, I mean, it's through the IRS. So if you do an easy
Not
form,
quick enough.
well, that's you're not going to make the October 12th deadline. There's absolutely no way. If we did your paperwork this weekend, we could not do it. That being said, you know, I have had people approved in less than 6 months. So, I mean, you might be able to catch one of the next cycles. Also, I mean, this sounds weird, but I feel like I've talked about 10 of you who have done this. Is there some nonprofit you formed 5 years ago that your CPA is still filing papers on? Is there an old nonprofit in your community that's sat dormant for a few years? You know, if they're still set up and active and have been filing necessary paperwork, those nonprofit organizations can work. So that's the route. If you can find an old nonprofit, that's where I would go, or find a community partner. That would be easier. But, you know, it might very well be worth, and in the future, you know, a lot of grant funds and a lot of foundation funds are for nonprofits. So definitely, you know, there's a lot of organizations that have a for-profit arm and a non-for-profit arm, NRHA being one of them. So, you know, you can look and have a form a nonprofit that could help your for-profit company if done right.
Okay, and this is probably beyond the scope of this discussion, but there's a question: how do we get a nonprofit started, and does Mark assist with that?
Mark does not assist with nonprofit. Let me just tell you, talk to Elizabeth, or Elizabeth, if you got some people you know.
I do it some for my clients, just out of a kind of a necessity, like that people needed it. You know, most of your tax guys will do it or lawyers will do it. I highly recommend you use the easy form on it, the 1023 easy. That's what I use. So, I mean, ideally, you probably could do it on your own. If you have any experience with that, you don't have to have a lawyer or a CPA to do it, but I mean, you definitely can reach out to them. So.
Yeah, there's a couple administrative questions, Danny, there. Number one is do we have the slides? Yes, the slides are on ruralhealthclinic.com/COVID-19. And I understand that they didn't download from GoToWebinar. That tends to happen a lot. Is it recorded? Yes, it will be recorded. It will be on our YouTube channel. It will be on our that same website, ruralhealthclinic.com/COVID-19, and it will be posted in our Facebook group for rural health clinics as well. So, Danny, you got the next question?
Yes, sir. Our hospital has a foundation that is nonprofit. Can we use the foundation?
Yes, 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 definitely. That's a perfect fit.
Okay, and then the other one that deals with kind of the same scenario, just to clarify, are government agencies eligible?
Yes. Public entity, so your town, any of your public bodies, public entities. So since some townships are set up that way, it depends how your township's set up, but yeah, county, city, town, townships, some. I know there's been a lot of questions about public universities, but again, most of them don't qualify on the rurality code, but I think they qualify as well. So that would be something, again, you can always ask your USDA office too, because there is a little leeway that states do have with that.
You got the next question, Danny?
I did, I was on mute.
Oh, okay, I was like, okay.
Yep, are cause without RHCs eligible for this grant?
Yes. So it can be a rural hospital, it could be a rural EMS service, a rural food bank. I mean, this was for rural health clinics, so that's why I geared it that way. But yeah, it can be any kind of rural, anybody providing rural emergency health care, rural health departments. But yeah, critical access hospitals are something definitely that USDA has experience in funding, and any kind of rural hospital definitely would qualify. The only negative is a lot of times hospitals are located in a little bit of a bigger area, so you may only qualify for a smaller percentage, like 35% of your project. But again, it's still, when you can get free money, it's definitely worth it.
Okay. If you have two projects that would qualify, a construction project and a mobile clinic, can you submit two separate applications?
I believe so. I have not seen anything prohibiting that. I've also seen where you can put multiple into one. So if you could fit that into your area and your scope, because I believe they're going to limit it to like 1 million per entity. So I think you would still only get that. So just to save yourself work, I would try to somehow combine those into one project. Also with people, doing, if you wanted to add some construction, add some exam rooms, add telehealth equipment while you're there. So if you wanted the mobile clinic or mobile unit and you also needed some alterations and renovations, I think the two could go hand in hand. You're bringing people to that clinic. And again, that gives you some freedom to say, we're going to target these people that aren't served, that are high poverty too.
Okay. If we started building a new clinic pre-pandemic, would we qualify for this grant to help pay for that clinic?
So pre-pandemic, I do not think, because I think it's anything after March 13th, 2020. And also I did ask some questions. So if you still would have had to follow all the proper rules, so they would have to see your purchase order, make sure you followed Davis-Bacon and all the appropriate building code regulations. So I think something pre-COVID probably would not apply. Now, if you think about it, if you've done it in stages, I did ask about that and I was told that probably could happen. So if you had like phase 1 that you started in January and then you started phase 2 in June of 2020, the phase 2 probably could be funded.
Okay. Over the last several months, we have been looking for an office space to put a clinic in a town with zero medical care. We are wanting to ask the city to apply for this grant to help us. Are we better off to purchase the property or rent and renovate property using this grant?
Okay, well, that's a double-edged sword because there's a lot of things you could unpack there because there's cost report implications to get your rate up. So there's some different things you could say there. But first, yes, you can purchase property with this grant. And so that would be allowable for the purchase. Would you want to rent? That would be up to you on if you want to do leasehold improvements to someone else's property. There are benefits to having a lease on the cost report versus purchasing. So, you know, I don't know. That's probably an individual thing. If you have specific questions, feel free to reach out to me individually and we can try to unpack that. But again, there's just a lot of things it depends upon. And but again, purchase of the property and constructing a facility, all of that are allowable costs.
Yeah, I think that would be sort of a pretty hard negotiating situation with the county or whoever it is, because there's going to be a lot of interest on who owns that building and what's going to happen after this grant is over. And you've got 7 weeks to get that figured out. That will probably be pretty tough to make happen that quickly when you're dealing with a governmental entity that's going to have all sorts of approvals to do that. So, and
USDA does maintain the right. It's up to them whether they do it. So not every state, not every program may exercise that, but they can put a notice of federal interest on that property because it was through grant funds. Now, does that have an impact? No, I had notice of federal interest on my clinics. It had no impact upon me. They're still clinics. They're still serving people. No one even knows, except probably for me and the CFO, who's now the CEO, that's even on there. So, but again, they do expire after so many years, but I don't know all the regulations on that. And I think each state USDA does handle that slightly differently, but that may be something too that you'd want to be aware of when you're purchasing property.
Okay, and a supplemental question to that one we just talked about, is there a downside for the city or town to apply for and then award the grant to us? Wanting to know how best to approach the subject with them.
I don't think so, because it's not really, I mean, unless they just have their own food bank or their own health department or something that was going to apply, which is highly unlikely, it's not really like they can compete with you on this. So if they say, well, is this going to stop us from getting our water money or our sewer money or our ambulance money or something, this is a different pot of funds. So usually in USDA, if they apply for one of those things, it precludes them from applying for another. This is different because this is rural emergency healthcare. So they can apply for this and still apply for their money for waters or sewers or whatever other town utility things they need.
Okay. We consulted with an architect firm to move our 20-year-old RHC next to the hospital, but didn't get the money spent before the CARES deadline. Could we use this information to submit to this grant? The RHC would be in new construction.
Yeah, I wouldn't see why. I think that'd be perfect.
Okay. We have lost revenue from the pandemic. Did you say that this is not intended to help reimburse lost revenue?
It can be. I don't know that that's what's intended. What I was reading on USDA today is that the lost revenue is an ideal match for the grant. I don't want to speak exactly how you can claim lost revenue or enter that because I am in no way an expert on that. And again, when I've talked to the USDA folks that I know, they're still learning that because this is the first time this has ever been something that's allowable for them. So I would keep checking. There was a little bit of information posted on the rd.usda.gov website today in the FAQs about the lost revenue. So go on that and look. I don't think it's going to provide you the information that you want, but I really think they're looking at projects more so than just making sure you got your lost revenue.
I thought that because we are an RHC, we cannot move our location and still have the RHC designation. Mark?
Danny, yeah, that's a question for me. You can move a rural health clinic if the area you're located is still considered, there's 9 conditions of participation. One of them is that you have to be in a non-urban area and your area must be a medically underserved area that has been updated within the last 4 years. If you still meet that criteria, you can move all you want to. If you don't meet that criteria, then you are stuck where you are. So is that the way you understand, Elizabeth?
Yeah, same. And check those designations. They are changing rapidly. So with some new government ways that they're doing the MUAs and HIPSs and stuff. So definitely go on the website and check on yours before you ever want to move.
Yeah, there's a couple of resources that people use. There's one that's called Am I Rural? If you just Google Am I Rural, there'll be a tool that you can use to look that up. And then you can go to what's called the HRSA data warehouse, and that will tell you if the area is medically underserved and been updated within 4 years. And what they mean by updated within 4 years is if the last update was on March the 3rd, 2017, you have until the end of the calendar year in 2021 for the primary care offices to update that. So you could, in theory, you're really over 4 years, but if you can get it done by the end of the calendar year, you can make that move as well. So watch that before you fill out that 855A, before you submit that, because that's going to be important.
That is all that we have.
All right, Elizabeth. Well, thank you for doing this. I know we've had way more of these meetings than you probably bargained for. So we appreciate you being a resource for our rural health clinic community and for us, and helping us get millions and millions of dollars into rural healthcare and to RHCs. And so everybody reach out to Elizabeth. She's been wonderful in helping everybody to get these sort of grants. So you got any last words before we shut her down?
No, but just get started right away, and really let's definitely take advantage of these funds while you have them. Again, maybe if we keep taking advantage, we'll keep being able to get more funds. So good luck.
Okay, and thank you everybody for what you're doing. I know the pandemic is really ramped up, and this has been going on 18, 19 months, and it's just, we really do appreciate what you guys are doing. So thank you very much, and we will see you the next time we do one of these. Bye, everybody.